here at Thomas Hospital. I'm with Dr. Brian Deering. He is part of the Cardiology Associates, and we were talking all about cardiac care and how important it is. First, I do want to talk about Cardiac Stat and how you are one of the founders, but how important it is, especially here at Thomas Hospital.
Well, thank you for bringing that up. Cardiac Stat is our program that takes care of people having the most serious type of heart attacks, which we call ST elevation MIs or STEMIs. And the whole country has Cardiac Stat programs or something like it in place. We were lucky to start ours in 2004 when a couple of us met with the EMS service and some hospital groups, and over time we developed it, and it's evolved into be an award-winning program. We got the American Heart Association Mission Lifeline Award about receiving STEMI cares and delivering prompt care. But it started in a goal to give care to these serious patients in the most timely fashion. And one of the big breakthroughs was when our EMS service started doing in-field EKGs to transmission these EKGs to us via our smartphone technology, so we could tell when a heart attack was coming in before they even arrived, and we could arrange our hospital for receiving the patient and our cath lab to take care of them. And this allowed us to give prompt care to the degree that our EMS service has won multiple awards for their work out in the fields and led us to be able to deliver prompt care to these sick people with ideal outcomes, getting the job done within 60 minutes or less.
Wow, well, congratulations to you guys. A very big deal. Now, I do want to talk about the importance of calling 911 in the case of someone having a heart attack.
Great point. Many patients try to talk themselves out of having a heart problem. They'll have symptoms and they'll say it's heartburn or something else. And after a while, they'll decide to present to the ER and they drive in by private vehicle. And that delays the care because, as we mentioned, the EMS teams can do an EKG in the field and we can identify this problem before they arrive and be ready for them to get good care in a prompt fashion. So if you're having chest symptoms, be it pressure, tightness, heaviness, or even unexplained shortness of breath, and you're not sure if it's heart, it's better to call the EMS service 911 and have them come out and evaluate you so they can get you here in a quick fashion and they can initiate care in the field.
Right.
We were the first ones in the state of Alabama to give a blood thinner in the field called heparin to help treat this heart attack before they even arrived at the hospital. So calling 911 saves minutes, which saves muscles, which saves lives.
Yeah, it's definitely something to remember. Dr. Deering, thank you so much. And now the manager of the cath lab, Ed Harrington, joins us, and we're continuing our talk about cardiac care, but you guys have won multiple awards throughout the years, but you just received one that means something a lot to you.
Yes, we recently received the Blue Distinction for Cardiac Care from Blue Cross Blue Shield. It's very prestigious for this area. We're the only hospital in Baldwin County that has a surgical program for anytime somebody's had a heart attack and they need surgery instead of what we do with stents. We're able to take them right around to our OR and get them the help they need to preserve that heart muscle.
Yeah. So along with being named the Blue Distinction Center for Cardiac Care here in Baldwin County, you also have something else that distinguishes you among the rest of the hospitals.
Yes, we are the only hospital in Baldwin County that has an open heart surgical program. Patients that come in, most of the time we're able to handle any kind of interventions that need to be done to open up a blocked artery. But every now and then patients will come in that have multiple vessel disease, or they'll have stenosis in the left main artery, or sometimes we call it the widowmaker. It feeds probably about 2/3 of the heart. In those cases, our cardiologist will refer those people to a surgeon, and the surgeon will come in, open heart surgery will be performed, and they will bypass that blockage instead of us putting a stent in, because we're just not able to get to that area with what we have.
Right. Well, we hope that you don't have to come here, but if you do, you know where to go in Baldwin County. In the meantime, diet, exercise, and live a healthy lifestyle. Thank you.
Thank you.
Please do remember the importance of calling 911. Again, a big congratulations to Thomas Hospital there in Fairhope.